We'll start by activating and palpating the forearm flexor muscle groups that originate from the medial epicondyle of the humerus. Starting with the flexor carpi ulnaris on the ulnar side of the forearm, we can use ulnar deviation to activate this muscle. Then moving into the palmaris longus, which can be activated by opposition with the thumb and the fifth digit. Palpating through this muscle, we can see the prominent tendon on the anterior surface of the wrist. Then moving into the flexor carpi radialis muscle. This muscle originates from the medial epicondyle also, and we can activate this muscle by using radial deviation. And lastly, we have the pronator teres muscle, which originates from the medial aspect of the humerus and attaches over onto the radius. This muscle can be activated by asking our patient to resist into pronation. To needle the flexor carpi ulnaris muscle, palpate through the belly of the muscle, and the needle can be directed perpendicular to the skin. Be mindful of the depth of your needling approach, as the ulnar nerve does sit deep to the flexor carpi ulnaris. Approach slowly and ask for feedback. Then moving on to the palmaris longus muscle. Palpate through the belly of the palmaris longus, and the needling approach is perpendicular to the skin, directly into the belly of the palmaris longus. Needling to the flexor carpi radialis muscle is also directed perpendicular to the skin, directly into the muscle belly. It is important to avoid any superficial vasculature that we can see also. And finally, we have the pronator teres muscle. Clamp the pronator teres in between your second and third digit and needle in between your fingers, approaching directly anterior to posterior. It is important to be mindful of the depth of your needling approach, as the median nerve does pass through the two heads of the pronator teres muscle. So approach slowly and ask for feedback.